Hey, thanks everybody for joining us. I wanted to start tonight by thanking you for the work you're doing to keep our country safe and to prevent the spread of COVID-19. I know for so many of you listening tonight and thinking about important questions, this is a dramatic change in lifestyle for so many of us, and we're grateful you're willing to take all the steps that we've all been advised to do, whether that's staying at home if you can, from work if that's possible. I know for some it's not. Whether that's making sure we're washing our hands and using hand sanitizer, the social distancing, the distance we try to provide between or create between each of us is obviously part of that as well. So we're grateful you're willing to do it. I know some of our friends and neighbors maybe aren't doing that yet. We have to continue to encourage them to do that, because it's not simply about ourselves and protecting ourselves and our families, it's about everyone else. And the last thing any of us want to do is to spread a virus to someone that we don't know, and especially to someone that we love. So I hope we all continue to do the work that we're doing. I'm in my office tonight in Washington, but I'm trying as best I can while I'm here, even though the hallways are pretty empty around here, to make sure that if someone approaches me, like a reporter, to ask a question, that we keep that distance between us. I'm trying to make sure that I'm doing everything possible to maybe use stairs more than an elevator, for example. And when we're voting, we've had a few votes this week, making sure that I go in to vote, don't get too close to people, and leave the chamber so we're not violating the guidelines in that fashion. So we all have work to do, and I know we'll all continue to do it. Secondly, I want you to know a little bit about, and I want to get to the questions. We have about 10 questions, maybe a half an hour in length. I can go longer, but I'll try not to keep it too long. But in terms of the work that's being done here, I try to remember it this way: 1, 2, 3. The first bill that we worked on a number of days ago, which is now law, was the preparedness and response legislation. That's bill number 1. It was about an $8 billion bill. It helped provide dollars for state and local governments, for example, to respond to this crisis, the kind of crisis we've never faced before, a common enemy, a virus that is affecting the whole world now in every state in the United States. That legislation also included new dollars for investing in the pipeline to develop a vaccine and diagnostics and other approaches to deal with this virus. Those will take a while, so there's some long-term investment in that. But that first attempt was a way to respond quickly. The second bill, bill number 2, just got passed last night. It took way too long in the Senate. Folks were holding it up for a good while, a number of days, but it finally passed. The president signed it into law. That has a number of features to it. I'll just recite them quickly. Unemployment insurance, help with that. Making sure that Medicaid was expanded or added, we added funding to Medicaid so that, for example, Pennsylvania got $1.5 billion more from that bill. We've got to make sure that our healthcare system has additional help even beyond this bill. We also provided a lot of food assistance in this bill for families and workers. You might have a family, obviously many who might depend upon the Supplemental Nutrition Assistance Program or a school lunch or school breakfast program. We've got to make sure that those students who are at home can still have access to food assistance as well as their families. There's a paid leave provision in it as well, which I might speak to a little bit more later. We made some good progress on that, but much more to do that we have to do in the third bill on paid leave. In that legislation, we were trying to be responsive to the needs of families and workers, so it was a larger bill than the first bill. But now we're working on the third bill, and of course this is the biggest bill that many of us will work on for the next 10 years or certainly for many years. And this is a response to what's happening in the lives of families and with regard to our workers, what's happening to small businesses, and what's happening, of course, to our healthcare system and our economy at large. So this bill is still in formation. We're still working on the ideas. Republicans have ideas, Democrats have ideas. There hasn't been a consensus yet, but there's a lot of debate and a lot of proposals that are kind of on the Senate floor, and I'm sure being debated in the House as well. So maybe as we go throughout the questions, we can talk more about that. But I want to start with the first question. Here's a question that came to us in a lot of different forms. Are there enough tests in Pennsylvania where we can be tested, and will the tests be free? That's a great question, because there was a real breakdown, a real failure by federal government agencies to get enough tests out. There still are not enough nationwide, and we still need a lot more in Pennsylvania. We had, as you might have heard, just last night, our first death in Pennsylvania because of this virus. And I wish I could say that would be the last, but the numbers will grow, and the number of cases, of course, will grow as well in Pennsylvania and around the country. So we do need more tests. Little bit of good news here in the what I call Bill number 2, the bill for families and workers that just got signed into law. That bill has a provision for free testing, so it doesn't cost you when you have a test. But here's what we have to do. We have to make sure that we're consulting with our provider, because they're the ones who are going to make the determination about who gets testing. I know the State Department of Health is working now with the federal government and state officials to provide more tests and more sites for tests. For example, the University of Pittsburgh Medical Center, as well as the Children's Hospital of Philadelphia, are providing tests. We know that in Pennsylvania we have a little bit better of a circumstance than a lot of other states, because we have state public labs where tests can be processed, as well as private commercial labs. So because you have two pathways, we should be able to provide more tests. But we have to continue to press the administration in Washington for more tests, and continue to put the dollars in place in this next bill to make sure that we can not only have enough tests, but those tests can continue to be free with no co-pays or no impediments. So that's question number 1, and we'll continue to provide information and keep fighting for more testing. Here's question number 2. Any chance there could be an emergency open enrollment period for healthcare? I think it's a great idea, not just because it's in a bill that I just filed today, but it makes a lot of sense. The insurance companies in our state and around the country should work with the federal government, with the administration in Washington, the Trump administration, to have a special enrollment period, at least 30 days, where anyone could enroll so they could get health coverage very quickly. That health coverage would help them, obviously, if they contract COVID-19, but even more broadly, because there are all kinds of healthcare impacts from this crisis. We want to make sure that someone not only has coverage, and as you know, we've made great gains in coverage with the Patient Protection Affordable Care Act, which meant that folks could get coverage on the exchanges as well as through Medicaid expansion. But also, we have opportunities now to cover more people. We should use those opportunities, especially in this terribly burdensome emergency that so many people face. These benefits should not be scaled down and limited. They should be comprehensive benefits. We should make sure that if there are co-payments, we should waive co-payments because of the gravity of this emergency. And we should make sure that if someone needs testing, obviously that there's no charge for that. And also if someone down the road, and this will be down the road a number of months at least, if not a year, if there is a vaccine and someone gets a vaccine, they shouldn't have to pay for that. That should be covered as well. So lots to talk about there, but I'll try to move quickly to get to all of our questions. Here's question number 3. I lost my job and unemployment isn't covering my rent. What are you doing to help people like me? Great question, because in this crisis, we can't just have a big bill coming forward, as I call it, bill number 3, that just is a bailout for big businesses. or for corporate entities. We have to focus in this bill, as I will, and as I hope more than just Democrats in the Senate focus on workers, helping workers. That means much more generous and robust unemployment insurance, or we could even call it employment insurance, so that people have the full measure of what they're making at work in terms of the compensation we can provide them. We want to make sure that those who are facing a challenge right now with regard to medications, those who need help with the ramifications of this virus, that they get the help that they need. Now, we did speak to this in the initial legislation, Bill number 1 I talked about. In that bill, there was about $500 million for medications, for supplies and equipment, but that's probably not going to be enough. We're probably going to need more than that. That's why this next bill, Bill number 3, is going to add to that as well. We know that when it comes to those who have lost their job, one of the most, or those who may lose time at work, they have to be made whole. That's why the unemployment insurance is critical. That's why we have to make sure we increase the funding for child care. So many people who are working face the challenge of child care. We got to make sure that we're helping the family get through this crisis when it comes to child care and give them more resources, but also help those who are providing the child care, the workers themselves. We also have to make sure that when families are hurting, that they have enough to eat. If you can't pay your rent, as the question indicates, and you don't have the economic resources to make ends meet, we've got to make sure that we're helping those families. The reason why it's important to get this third bill done quickly is I'd like to see legislation or provisions of this legislation where we say there's a moratorium on foreclosures, a moratorium on actions by landlords to take action against someone who hasn't paid their rent. We've got to make sure that we're meeting we're meeting directly that immediate need that renter or that homeowner is facing. So some of these provisions I think we could put in this bill to stop actions against someone who lost their livelihood or lost their ability to pay their bills because of a virus, not because of something they did, not because they took the wrong action or the American people took the wrong action. This is happening because of a virus. It's no one's fault. We've got to be responsive to that reality. This isn't like 2008, where big financial institutions engaged in practices that were criminal, and they caused the problem. This is different. Workers and families and small businesses are being hurt because of a virus, because of something that occurred naturally. So we have to be cognizant of that. I would also say that when it comes to some of those frontline workers, we got a question that I won't mention the town, but this questioner said, my brother is a paramedic in this particular town in northwestern Pennsylvania. That's all I'll say. He told me last night they don't have enough masks or equipment. What are you doing to get equipment to our healthcare workers who are on the front lines of this? Similarly, how is the federal government addressing the predicted shortage of ventilator staff, medical supplies? Big question and a great question. Number one, this bill that we're working on now has to be an immediate direct response to that. Democrats in the Senate want a Marshall Plan, literally a Marshall Plan for this, like we did after World War II, the Marshall Plan where the American people said, we have to be part of rebuilding Europe, because if Europe is rebuilt, we will be safer in America. That was the Marshall Plan. It was a really good idea then. We ought to have the same spirit when it comes to supplies and protective equipment. Protecting workers, those brave workers in home health settings, in nursing homes, in hospitals. These are as brave as any soldiers have been brave over the course of our history, going right into the fight every day. We've got to make sure that they have the protection, the mask and other protective gear. There's not enough of it. Hospitals are running out of it. Other healthcare settings are running out of it. This bill has to meet those those basic demands, those imperatives. Here's what we're trying to do. We're, in addition to the legislation, to provide a lot more funding to immediately move into more production for protective gear, we got to keep pressing the administration. Here's a little bit of good news on this front. The Department of Defense announced just yesterday that they would produce 5 million masks. Now, the administration made some other promises they didn't deliver on. I hope the Defense Department will come through. Secretary Esper announced that. That would be good if that happens, and we want to push them to make sure that happens. They also talk about more ventilators, the Department of Defense. 2,000 more ventilators they're promising. But most of this has to happen through the bill and through the actions the President can take. When the President invoked the Defense Production Act, that's an emergency action that we haven't used since like the 1950s. By invoking that, the President can direct an industry, can direct a company to produce more of this personal protective gear. The President should exercise that and demand that we have immediate production. Just like when Franklin Roosevelt said, we need more tanks or aircraft carriers or ships, and they directed companies to start producing those pieces of equipment and armaments for World War II. We have to continue to think about this, as the President and others have said, we have to think about this like it's wartime. Let me go to the next question. Is there any plan for financial relief for small businesses? I'll answer it two ways in terms of two bills, or in terms of one big bill. I'll start with the big bill. Bill number 3 that we're working on right now, if there's one area where there's consensus between Democrats and Republicans, I think it's in the area of small business. Both parties want to do this. Both parties are working on proposals that we can update you about when there's more detail. But there's no question that our small businesses need direct help. They don't need promises. They don't need a waiting line. They don't need something 3-4 months down the road. They need direct help. That means the Small Business Administration has to provide loans right now. No interest loans, grants even, to small businesses to rescue them from the predicament that they're in right now. A lot of small businesses in Pennsylvania, around the country, don't have enough money to get through 2 months, or even 1 month in some cases, let alone longer than that. We have to be responsive to that. Part of that help was provided in earlier legislation, but it's not nearly enough. So this bill we're working on right now, and that's why we're consulting now with small business leaders in Pennsylvania to make sure that those dollars are there. We'll have to do more than just up the funding for or change some of the rules for the Small Business Administration. That will not be enough. We need to have in this legislation, and this is being worked on as we speak, a special facility, I'll call it, or a special entity that can provide immediate help for small businesses. This is an emergency. This is for small business a matter of days and even a few weeks, not months. So I think both parties get that. I think you're going to see some good ideas coming forward in this bill. The next question is, there's no right to paid leave in the state. I think that's true of a lot of states. The question says, this hurts with the most vulnerable among us. How can we social distance if we're still expected to pay our bills during unpaid leave? A great question, because paid leave is long overdue for so many American workers. Here's what's happening on that front. First of all, in this bill we just passed and the President signed last night, that provided some of the only paid leave we've seen in recent American history. In this case, 2 weeks of paid sick leave was in that bill, and up to 12 weeks of family and medical leave. That's the good news. Bad news is it didn't cover enough people, enough workers, I should say. As many as half of workers across the country can't benefit from that because they're working for large companies, just by way of one example. So we've got to do a lot more and be a lot more generous in bill number 3 on paid leave and on other family and medical leave. Now, one way to do that is to back the legislation that I voted for yesterday. We had a vote on an amendment yesterday in the Senate. It's called the Paid Leave Act, and PAID is an acronym. The Paid Leave Act would provide a paid leave for all workers, not half of the workers, not some of the workers, not three-quarters, all workers, and especially in paying paid leave in an emergency. That's the least that the federal government should do. To say we are in an emergency, this is a war against a virus, we need to give families, workers, that peace of mind that the Paid Leave Act provided. Now, unfortunately, our side voted for it, the other side voted it down. We'll give them another chance, we'll say, in Bill number 3. Because Bill number 3 is going to have Republican ideas, Democratic ideas. We have to work out differences between and among us, and then we have to work out differences with the House and the administration. So, Republicans in the Senate have a second chance here to get paid leave right. I hope they take it, because we've got to make sure that there is peace of mind for these workers and for their families. They didn't cause this problem. A worker didn't cause it, a small business didn't cause it, and we can't have a policy that pits the worker against the small business. Some politicians want to do that. That's wrong. We got to make sure that the worker can benefit and the small business owner can survive. And that's part of the reason we have to be extraordinarily generous with paid leave in this emergency period at least. This cannot be limited by some discussion of, oh, we don't have enough money. If we're going to have a $1 trillion bill that's passed by the House and the Senate and signed into law, we damn well better get it right when it comes to workers. And so I think we can do that in this piece of legislation. So there's lots of ways to cover paid leave and do it in this emergency. So our next question is the following. Can the federal government do anything to ensure the continuity of needed support services for people with a disability? So if my question is right here, this is our 7th question, I think. I think I'm right about that. 1, 2, 3, 4, 5. Yeah, our 7th question. We'll have about 11, I think, when we're done. But folks with disabilities, I can't even begin to imagine, as hard as this crisis is for a mother who's in the workforce and has children, or a dad in the workforce who has children, or a senior who's living on a fixed income and is in an age category where they're particularly vulnerable to this virus. Those circumstances are beyond my comprehension because I'm not living in those circumstances right now. I also can't imagine what it's like to be someone who has a disability who has challenges every day of their life, and then on top of that, this virus creates its own complexities. But I also think there are a lot of people that are willing to help, and I think there's bipartisan support for this. I just happened to introduce a bill today which spoke directly to 2 groups of Americans, senior citizens and people with disabilities. And of course, some people are in both categories. They could be a senior with a disability. We've got to make sure that those individuals, those Americans, are given tremendous support in this bill coming up. That's why I introduced the bill, and we've got more than half of the Democratic caucus on the bill right now. And number 2, we have to make sure that the workforce that's helping those individuals are protected as well. Those brave Americans who are working in a nursing home, working in a home and community-based setting, where a senior is at home and they're providing home health care, or they're providing great health care to a senior or a person with a disability in a hospital. We have to make sure those workers are protected physically or literally in terms of them delivering the care with good personal protective equipment and other supports. And we've got to help those workers in their life, in their family life, and what they have to do to help their children and to survive. So there's a lot more we got to do. But I think one of the things we can do for the workforce is to make sure that we're helping them with their pay, with their overtime, with their travel expenses, We've got to make sure that as we're helping an individual with a disability or a senior, that we're thinking about the workers, whether that's their protective gear, whether that's technology. Now we know because of technology, if that worker for some reason is not able to get to a senior or into the home of a senior or a person with a disability, we know that technology can connect them, where they can at least provide remotely some support and some help for the person that they work with every week of their lives as a healthcare worker. We've got to make sure that that technology is available. We also have to make sure that the agencies that employ those great workers are protected as well. We can't have support only for for a worker and have the agency, which in essence would be often a small business, to have that small business or that agency go under. So we've got to provide that help directly. So I know we're going to be running low on time, so I'll try to talk faster as best I can. But there's so much more we have to do, and my bill is a very generous bill for seniors and people with disabilities. This question said, are there any provisions being considered to help stabilize and support retirement programs that will undoubtedly feel the effects of losses in the stock market? No question about it. The first thing we should do is make damn sure that the proposals in the Congress to cut Medicare and Medicaid are defeated. We have to stop those efforts. Now, I know that's not right in front of us, but there are proposals in the current budget to cut Medicare and Medicaid. We have to stop those efforts and fight hard on those. But there's no question, because of the adverse impact on the economy that this virus is wreaking havoc on, that these programs could be adversely affected. So we've got to take steps in the short term and in the long term to protect them. I think the one thing we can do is make sure that as we develop Bill number 3, that we do everything possible to make sure that when the losses are hitting, that we have reserve funding or other strategies to supplement the revenues of these programs. So that's going to be something we've got to do, both short-term and long-term for Medicare, Medicaid, and pensions as well. The next question is, how can we ensure that immunocompromised individuals have access to their prescription medications? There's so much to talk about here, but in particular, we've got to make sure that the individual who may be in those circumstances, whether they're immunocompromised, whether they have underlying health needs, whether they're a senior, whatever circumstance they face, we've got to make sure that they have enough prescription medications for the duration of the next couple of days and weeks. One of the things we could do is to make sure that the Centers for Disease Control are helping us with providing the opportunity to allow folks to pick up medications earlier, so they're not, by way of rule or regulation, constricting the early delivery of medications. I know that in a lot of communities, they haven't waited for the federal government to take action. A lot of pharmacies and communities generally are helping to provide free delivery, and you have volunteers who are helping out as well. All those efforts should be replicated or imitated, but free delivery of prescription drugs to a senior obviously is vital and life-saving. And I think the 90-day idea about having 90 days worth of prescription medications is something we should not only support but fund if funding is necessary. Maybe 2 more questions, and I know we have to wrap up. And I'll ask Jenna how much time we have. A couple minutes, okay. One question that kept coming through, and I know it's on the minds of a lot of people, is, are we overreacting? And I wish I could say yes, but of course the answer is no. I think everyone knows that by now. Most Americans get it. Most Americans understand that they have a responsibility as an American, that we're all in this together, that we're all part of one American family. We've all got to do our part. And so those who thought initially maybe, and some of them unfortunately were politicians, and I'll try not to dwell on that because I get pretty angry when a politician acts irresponsibly when it comes to providing guidance or directing people to do the right thing. But those who thought the calls for social distancing or other practices were too much, I think are finding out that that's the way you save lives, that's the way you prevent the spread of the virus, that's the way you bend that curve where we hope that if the number of cases keeps skyrocketing, as it will, that it can level off and then go down as opposed to keep going up. We don't want to be Italy, and you know the graphs and the charts about the number of cases and deaths in Italy. So we've got to continue to be prudent, to be careful, to make sure that we're taking all the steps necessary to prevent the spread of the disease, but not to panic. Do the right thing. Work within the guidelines. You have so many good ideas from the Centers for Disease Control. You have guidance provided by the Pennsylvania Department of Health, guidance provided by your provider, your doctor, or a healthcare professional that you consult, as well as folks in county health departments and the like. I wanted to give one phone number. Some may have this, some may not, for the Pennsylvania Department of Health, because they provide a range of good ideas in terms of the virus and in terms of steps you can take. That's 1-877-PA-HEALTH. 1-877-PA-HEALTH. And going to calling that number or going to their website will give you some good ideas. Obviously, the Centers for Disease Control, CDC, has a lot of good guidance as well. We have so much to do, not only in terms of the legislation that we're working on that we hope we can pass in a matter of days. I don't think it'll be tomorrow. I don't think it'll be Saturday, but maybe by the weekend we'll start voting, or at least starting to come together on a major piece of legislation. But we still have an awful lot of work to do. Each of us have to continue to maintain the good practices that we've engaged in. I think it's becoming part of our daily life, and that's good, that we're getting to a point where we understand that we're going to have to do this not for days or weeks, but for longer. But I think most people are taking personal responsibility for that. So I know the last question, and I'll try to do this quickly, the Families First Act, that was the bill that just got signed into law. There's a lot we can talk about there, but I'll try to shorten it. One good provision in that bill was unemployment insurance, but I think, again, we have to do more on that in Bill number 3. The bill also provided more dollars for Pennsylvania for Medicaid, and that was good. Pennsylvania will get $1.5 billion extra dollars from Medicaid, but because it is such a consequential program for seniors, in nursing homes and long-term care, Medicaid helps our children from low-income families in rural areas and in cities and small towns. It also helps, of course, people with disabilities, because Medicaid has such a substantial and positive impact on the lives of our families. We're going to need more than the $1.5 billion we got in Bill number 2. So in Bill number 3, I'm going to be pushing for even more Medicaid dollars, which is not only important for healthcare reasons, it's also important for the state's budget. It's important for fiscal reasons. If the federal government helps more on Medicaid, state taxes don't have to go up a year from now or 2 years from now. So we got to help with that. Lots more to talk about in terms of Bill number 2 that just passed. I outlined the paid sick leave, which we have to do more of. But on this bill coming up, I think it's important to end with this. In addition to the things that I talked about, that we've got to help small businesses, we've got to help workers more, we've got to help those who are running major institutions, like our colleges and universities, which are big employers in communities and support the livelihoods of a lot of people in our small towns and communities. There are some things we can do directly. I mentioned before about that worker who is trying to make ends meet and trying to hold their family together, but they're losing their pay or losing their job or having other adverse consequences. We should have a policy in this bill: no evictions for a period of time. This is an emergency. No one should be evicted. No one should be penalized for not being able to pay their rent because of a virus, because of a common enemy to the human race, not some decision that people made. We should at least have a period of time, maybe 6 months, for no foreclosures, no evictions. We should also have low or no interest loans for small businesses. Direct help, not with a big interest rate. We should also help provide direct cash support for families. We can do that. And it shouldn't just be $1,000 and then you're done. That doesn't make any sense. We can't just have help to get people through April or May. We know that they're going to be hurting in June and July and August for a number of months at least, if not longer. So we should provide a very generous direct support for workers and their families, and have that persist for a period of time till people are through this crisis. So there's a lot more we can do, whether it's forbearance on mortgage payments or the like, as I mentioned, about no foreclosures and no evictions. But we want your ideas to keep coming to us, so please provide as much as you can by way of ideas or suggestions, because we're getting to the point where the bill is starting to be written. But it's a big bill, so it'll take a while yet. It won't take hours, it'll take a number of days. You also don't want to overthink this in terms of spending weeks on this. We should get this bill, as big as it is and as consequential as it is, we should get this through the Senate early next week at the latest. I hope. That's what we should do. And then get it through the House, get the President to sign it. I hope he could sign it next week, so that people at least know, as they're going through the horror of this crisis and all the pain and misery this virus is causing, at least at the end of the road, there will be backstops and protections and supports for a small business, a mom and a dad trying to make ends meet, or a worker who's struggling in this difficult economy and this difficult crisis. So I appreciate all the time you've spent. I hope I didn't keep you too long. We'll try to stay in touch as this bill is developed and as we do everything we can as Americans to do what we do best, to meet this crisis head on, to do our part individually, to get our families, our Commonwealth, and our nation through this crisis. Thank you, and God bless you.